I think this paper tries to really optimize medical therapy for endometriosis. It's really a attempt at precision medicine for endometriosis. We know the first line therapy for endometriosis is an oral contraceptive pill, and it's the progestin in the oral contraceptive pill that prevents the growth of endometriosis, and often effective, but about a third of the time it fails. They are progestin resistant. And we've done a lot of research in the laboratory to show that this progestin resistance comes from either the progesterone receptor being expressed at a very low level, there's no progesterone receptor to respond to that progestin, or it's dysfunctional in some ways, and we're investigating different ways that the progestin receptor fails to work properly. But knowing that ahead of time, we could avoid treating a patient with an ineffective medication that just delays their definitively getting to the, or delays their time to the correct, proper treatment. We have multiple other treatments available for endometriosis. If we could do a test beforehand that gets them to the right drug the first time, we could really expedite them getting to that time when they're pain-free and getting their life back. Unfortunately, we delay things because we try an oral contraceptive, and sometimes when that doesn't work, we just switch to another one. They may try a few different pills before they move on to another therapy. If we could stop that, tell them the progestin therapy isn't going to work, tell them an oral contraceptive isn't going to work, that they have a progesterone receptor defect, and move on to another mechanism of action or a treatment that exploits another mechanism of action, such as a GnRH antagonist or an androgen or one of the other medications we have now to treat endometriosis effectively. We've been able for some time to tell if progesterone receptor is absent in a surgical specimen, but that's too late. They've already failed medical therapy going on to surgery. We wanted to develop a blood test. The first thing we did was actually look at progesterone receptor in white blood cells, and it's just not expressed at high levels. It wasn't a useful test. That would have been easy. It's not that easy. So we started to ask, were there other things that might also correlate with that progestin resistance? We know that there are epigenetic changes in endometriosis, modification to DNA that changes the way genes are expressed, and we see that in progestin-resistant cases. So here we took blood from patients with endometriosis or those without endometriosis. We screened broadly the whole genome for different epigenetic changes, methylation of DNA, and we found a few genes that had a different methylation pattern that correlated with lack of response to progestins. They're not the progestin receptor as we expected we might find, but other genes that are clearly correlated with lack of response to progestin, and that will predict who will respond to a birth control pill. So again, we can get a simple blood test that will tell us whether a birth control pill is the right or wrong place to start for our patients. We can get them onto an effective therapy the first time rather than a trial and error approach to treating their endometriosis. Personalized precision medicine for endometriosis.